Gentleman yields back. Now recognize the gentlelady from Pennsylvania for 5 minutes.
Thank you. And before my 5 minutes, I ask unanimous consent to enter into the record what Mr. Neguse had hoped to enter. Ethics official owned Meta stock while recommending FTC chair recuse herself from Meta case. Thank you. Thank you, Mr. Chairman. Thank you, Chair Khan, for being here, for speaking with us today about the important work that FTC does to safeguard consumers and crack down on companies that would exploit them. I come from a perspective of, as a mother, as a grandmother. I care about exploitation of seniors, of children, of businesses, consumers generally. In your written testimony, you explained that FTC works to protect privacy and data security, fight fraud, including fraud related to opioid recovery, and ensure that domestic manufacturers and small businesses have a chance to compete fairly. Somehow Republicans are using this time in other ways. I apologize, I'm late to the hearing today, but I'm pretty sure I'm glad I missed some of what happened. I was in another hearing with Secretary Kerry on the climate crisis, so forgive me for coming late. I wanted to ask you about the issue around opioid addiction and abuse and what FTC is doing. I know that FTC recently returned $60 million to people suffering from opioid addiction. I know you know as well as I that the crisis, the health crisis, public health crisis in this country around the flood of opioids and opioid addiction is grave. 110,000 people died last year of overdose. That's 300 people a day. Can you tell us about your work, FTC's work, to try to protect consumers? Maybe this case, the $60 million case with Rectic, I don't know how to say that. Can you tell us about your work in that area?
Yeah, happy to. And we were, this is a newer authority that Congress gave us, and I've been pleased that we've been able to quickly put it into action. We brought a set of lawsuits using this authority to make sure that if companies are deceiving potential patients of opioid recovery facilities, that we are acting quickly to prevent that deception. We brought a case against a firm called R360 because we found that they were engaging in some of these deceptive practices in ways that were harming opioid recovery patients. We recently brought another action that also noted that deception around tobacco addiction recovery is also illegal under the statutory authority. So we're working hard to make sure if people are being deceived in ways that are illegal under this authority, we're acting and we're getting the money back.
Well, I thank you for that work. I hope you will continue in a robust way. And for full disclosure, I have a son in long-term recovery, 10 years in recovery from opioid addiction. We've lost too many others to this problem, and the deceptive practices are so egregious that it's very upsetting. I wanted to move to, if I have some time, I do, good. Pharmacy benefit managers. They operate behind the scenes. Consumers don't really know what they're all about. They're a middleman in the drug market and determine patients' access to medications as well as the prices consumers pay. In this role, PBMs have the power to raise prices and are part of the reason that consumers pay 20% more than they should for generic drugs. Can you speak to what FTC is doing around the issue of PBMs and disclosure to consumers and cracking down on the price hikes?
You're absolutely right that these firms are oftentimes behind the scenes, so people are not directly interacting with them, but oftentimes their decisions are determining what medicines make it onto what's known as the formulary. And unfortunately, we've heard reports that suggest that rebates between drug manufacturers and the PBMs may be keeping lower cost generics off the formularies. So what that means in practice is there's a lower cost generic out there, but when a patient is going to the pharmacy, they're not actually able to get it. They're having to pay more for the branded drug. And so, we've said in our policy statement, we are very concerned about that and are looking at it.
And yes, and how can we interrupt that? Can FTC have some rulemaking, some effectiveness in interrupting that blockage of information to the consumer?
So we're looking closely at whether, there may be violations of the FTC Act. The Robinson-Patman Act also prohibits certain types of kickbacks, I believe under 2C of the Robinson-Patman Act. So we're really laying out all of our authorities and making sure we're using them to address these issues because, oftentimes we hear from insulin patients about how they haven't been able to afford life-saving medicine potentially because some of these tactics. So we recognize the urgency of this work.
Again, on behalf of consumers and seniors and kids out there, thank you for your work and the work of your entire team. I yield back.
Gentleman